All right, so we've got to do our standard jokes. You ready? How about this one? Why did the skeleton ride the roller coaster? Why did he ride the roller coaster? He didn't have the guts to quit. You guys are a tough crowd. All right. How about this one? I'm going to skip that one. All right, how about this one? What has two holes, no legs, and runs?
Nose.
A nose. Very good. All right. Okay. So a couple of comments about the post quizzes, because I just want to address this so that everybody's on the same page. So some students have reported that post quizzes are actually the most difficult part of the class. And the reason for that is possibly because one or two questions on the post quiz, you have no clue. You've never heard the information before. And that's intentional. And I'm going to explain why. It's not because I'm trying to be mean. It's because I'm trying to stretch you a little bit. What we're really good about in undergraduate education, especially today, in today's culture, is telling you what we're going to test you on, then giving you the information we're going to test you on, then helping you remember what the information is that we're going to test you on, then providing you with the answers that we're going to test you on, and then ultimately giving you the test. And what we breed are students that do really good on tests. But if I ask you a question that's slightly outside of the box, and I haven't prepared you, you're completely clueless. You have no idea what the answer is. And the comments that we get back is, well, we didn't cover that. Yeah, I want you to, use this. I know, but you need to tell me what the answer is, and then I'll use this. No, that's not how it's going to work in this class. Now, not everything's going to be that way. I'm only going to write the exams based upon what I lecture on. So I am going to tell you what I'm going to test you on. But the post-quiz is my one opportunity to maybe challenge you to think a little bit beyond the scope of this class or what we've covered. And you have the ability to go look up the answer. Okay? So I feel that's a fair way to push you a little bit. And let me give you a practical, real-world example that's happening right now in my life as we speak. And so all of you know that my mom's battling cancer. Well, mom's here in Flagstaff now. We brought mom and dad here, and they have a home here, and they're getting great care at FMC. And it's actually amazing because mom keeps telling me, wow, I feel like it's more of one-on-one care. There's not as many patients, they're not as busy, they're able to spend more time in a town of 70,000 versus whatever it is down there, 5 million or whatever the number is in Phoenix. So they're getting great care. However, the healthcare providers, which many of you are going to become, are stumped right now because her symptoms are confusing them. And they're having to think outside the box on stuff that they've never seen before. Okay? So this wasn't a patient that they had last week. It's not a chemotherapy patient that they've ever experienced. This is a brand new situation, and they've done one thing and they got side effects, and then they corrected those side effects and they got a whole new set of side effects. And now some really smart people are trying to work together to figure out, okay, what are the next steps to do? They're looking up information. They're trying this. They're getting into the literature. They're actually using their brain. And so that's what's going to happen in the future. And if you go into research or you go into another field, you're going to have the exact same situation. The experiment's not going to work out the way you planned. And you're going to go to your supervisor and say, well, I'm upset with you. You told me that this is what the hypothesis was and what we expected, and I got a different result. Now what do I do? Say, well, now you use your brain and you think about what the next steps are. So there's only a couple of questions every week that are probably going to puzzle or perplex you in that way. And that's the whole point of those post quizzes. Okay? You can look it up. I'd like you to work alone. Can I police that? No. But the intention is for you to think on your own. It's a time test, so you can't necessarily, look up the answer for too long. There's only 30 minutes to do it. But most students are going to find there's probably 3 to 4 questions that they know right off the bat. You've been studying, you read the material, you listened to the lecture, maybe you reviewed some sections that were a little confusing on the posted lecture on YouTube, and you got, in 5 minutes, you've answered 4 out of the 5 questions. It's that one question that you're stumped on. And then you spend the bulk of your 20, 25 minutes trying to figure out what's the best possible solution. Okay? So, if last week was a disaster, you can drop that post-quiz. You get to drop your lowest post-quiz. So you get a clean slate. It's very common for the post-quiz exams to be slightly lower, post-quiz scores to be slightly lower than the pre-quiz scores. Okay, so if you got the pre-quiz, you got like an 8 or a 10 out of 10, and then you got like a 6 or an 8 out of 10, and you're kind of bummed out, I wouldn't be as bummed out. And if you look at dropping the lowest, and then the fact that there's 3 exams plus like 11 pre and post quizzes, there's a lot of points to go get. So it's not going to kill your score if you have a 1 bad week performance. Okay? Any questions on the post quiz in the philosophy mind? Yeah.
Can you give the post quizzes and stuff? Are they typically going to be things that we can find in the book, or is it going to be required?
Most oftentimes you'll find, the question is on the post quizzes, can you find the answer in the book? A lot of times you will. Sometimes you'll be able to figure it out from lecture, or it'll be maybe a disease state that we didn't cover. It's in the book a little bit, but you can find it online pretty actively. And the other thing too is, nurses and physicians Google stuff all the time. But knowing what's quality information to read and what's crap information to read is a new field of academia that when I was in college we didn't wrestle with. And so you guys, it's kind of the yin and the yang. It's good for you that you have access to that much information, but it's also dangerous because there's a lot of bad information out there. So this is partly me encouraging you to go look for good information and trying to sift through kind of the wheat from the chaff, if you will. What's the good stuff and what's the bad stuff? All right, that's a good question. All right, hopefully that was somewhat clear and helpful. We're going to dive into the last little part of the lecture from last week. And it'll go real quick and we'll move right into inflammation. The last little component here is going to be talking about different manifestations of cell injury that happen inside the cell. And the first one up is pigmentation. We're going to see some evidence when we have cellular injury. Remember last week we talked about necrosis and we talked about apoptosis. And we compare and contrasted both of them. Want to bet on the exam there's going to be some type of question about comparing and contrasting or different attributes of apoptosis versus necrosis? Absolutely. Okay? Now there's going to be some other things that happen other than just the cell dies. And it could be that the injury is prolonged and so things change chronically over time and they build up. And one of those things is actually what we call pigmentation. So pigmentation is coloring of the cell. That's weird. So, in this slide, we've got 2 preps of liver. And these 2 preps of liver are shown by these blue arrows. And the liver is an organ that takes up excessive iron. And this excessive iron can come down from a variety of different places, or come from a variety of different places. So for example, the iron recycling that takes place can be from old blood cells that are actually being recycled. It can be from macrophages that have phagocytosed the iron and have brought it to the liver. And so this is normal imagery that comes from normal liver and 2 different types of stains. In this stain over here, This is a blue Prussian stain, and so the iron molecules are lit up with this punctate blue dots. Up here, it's a different type of stain. It stains it a brown color. It's more of a DAB, a diamidobenzene stain, which stains it brown. And the brown is the iron. So you can see the brown clusters versus the blue clusters, just an indication of the iron that's present in the liver over time. So in an older patient, you might see more iron uptake or hemosiderin, and then in a younger patient. Okay, so on autopsy, if you're trying to identify a patient, that might be one way to look at potential age. Is it a young patient or is it an older patient? Another one is a marker, lipofuscin. This is the uptake of broken down organelles or intracellular parts. And it's mostly lipid in content. And this is the dotted red arrow going to this one. This is heart tissue. And lipofuscin is very prevalent in older hearts of maybe geriatric patients. It stains a brown-yellow color. And you can see the arrowheads, or the arrows, right here, there's a little bit over here, and then there's one right there that's not even labeled. That's lipofuscin. And this is an indicator of wear and tear on the tissue. And so as we get older, and our heart is working harder, then we see more lipofuscin uptake in certain organelles or organs, like the heart. And that's another way to actually kind of tell the age of the patient on autopsy. Okay, so hemosiderin, iron, and lipofuscin, which is basically lipid, phospholipid bilayer, or lipid material from the organelles. Intracellularly, we also see the accumulation of calcium that takes place. And there's two main types. There's dystrophic and there's metastatic. And dystrophic is indicative of sort of older or tissues that are aged and or dying. And the dystrophic calcium uptake that you're seeing in this particular picture, this is an aortic valve. And all of the sort of white little clusters that you're seeing here are the calcium. So this is all calcium accumulation right here. So we see a characteristic in aortic valve stenosis, which is what you're seeing here. So the valve leaflets, here's the 3 leaflets right here, 1, 2, 3. And you can imagine in that patient, as the aortic valve leaflets become more calcified over time, they become a little stiffer. And so they don't work and close quite as efficiently. And now you have aortic valve insufficiency, or what we would call aortic valve regurgitation. And you can hear that with a stethoscope. You'd be able to hear that swooshing sound. As it's supposed to close, you would hear fluids, blood still leaking out. Well, we also see this in tuberculosis patients. We see it in their lymph nodes. We'll see it in atherosclerosis. The actual arteries that are atherosclerotic in, say, an 80-year-old patient will be crunchy like stone when you touch them, when you palpate them. So we look at a lot of atherosclerotic vessels in the lab, and we try to determine ways to model the atherosclerotic lesions on the benchtop so we can build devices to treat it. And so the one thing that we do is we actually source cadaver vessels. And we pull these cadaver vessels out, and we come in with a razor blade, like a standard straight razor blade. With one swipe through that blood vessel, if it's progressed in an atherosclerotic lesion aggressively, it'll completely dull that razor blade. It's like cutting through stone. You can hear it crunch. And then we will fillet it open, and then we do this hardness testing of the luminal surface of the blood vessel. And then we've been trying to match it with different types of materials. We've looked at plaster of Paris, we've looked at chalk, we've looked at different types of stone. And the most common type is this pumice stone that's the best match Have you ever had a pumice stone? Do you know what a pumice stone is? It's kind of what you use to scrub your heel, or maybe, you know, pumice stone used to clean like faucets or toilets. It's kind of like a spongy looking stone, but it's a stone. That is the hardness that most similarly matches atherosclerotic lesions that have been calcified. Pretty crazy, okay? So calcium accumulations that are dystrophic are those type. Metastatic calcifications are usually deposited due to hypercalcemia. So patients that have high levels of calcium in their blood that isn't supposed to be that way usually will develop these metastatic hypercalcemia deposits throughout the body. Where do they go? Well, they go in all sorts of different places. You might find them in tumors around the body. You might find them in the bone, in areas that aren't supposed to be overly densified. And then you might even find them in other types of organs, like in the thyroid. Okay, the last slide of this lecture is a review question to give you kind of an example of how we might ask a question on the exam that's backing up to the lecture component from last week. So the gross appearance of the myocardium shown here from a 58-year-old man who was admitted with chest pain is most consistent with which of the following microscopic changes? Liquefaction necrosis, feces necrosis, fat necrosis, coagulant necrosis, or apoptosis. You guys all buy a clicker? I hope not, because we're not going to use it, but let's pretend we are. How many of you say A? This is the manual clicker. Okay, how about B? Did you notice how I switched hands, switched arms for the other option? Okay, how about C? How about D? Okay, D's might have it, and then E. Those of you that are going to vote E just saw the D's and said, well, I'm not going to put my hand up. So, D is the answer. Why?
Well, I know that you said coagulative is more common in the heart muscle.
She said that I said that coagulant necrosis is more common in the heart. And you would be correct, and I was correct. So, sometimes if you can't tell, some of you are like, well, I can't tell. I thought you said it was wedge-shaped. Okay, well, this is biology. It's wedge-like. Okay? So, where is the wedge? Well, here's a component right here, right, that widens in this area and narrows in this area. Like, that's not a wedge, Kelly. Well, it's wedge-like. It follows the pattern of the vasculature. Okay? Another way to determine this is remember which organs are most commonly associated with which types of necrosis. Okay, so up front she said heart is most consistently coagulant necrosis. So if you know if it's heart, kidney, spleen, it's going to be coagulative. Okay? All right, perfect. Any questions from our cell injury lecture?